Hi, everybody. This is Mike Vecchio coming to you from my living room in these days of the pandemic. Rogers wanted to put out a little program, an update. We're calling it the Road to Recovery for Elgin, Middlesex, London, or EML. Today, I'm joined by Minister Jeff Yurek, Member of Parliament Karen Vecchio, and Mayor of St. Thomas Joe Preston. I want to thank you all for taking the time to be here and spending some time with us, taking time out of your busy schedules. Thank you.
Thank you.
Great to be here.
All right, so everybody's safe and sound in their home. I know you guys have probably been working day and night over the last couple of months. You all look fresh and bright, though, this morning, so that's great. Thanks for cleaning up for the program. We'll start today with our Member of Parliament, Karen Vecchio, to give us a little bit of a brief update on where you've been at for the last couple of months and what you've been doing.
Well, thanks very much, Mike. And to be honest, being interviewed by you when you're in one room and I'm in the other, it's kind of interesting, this whole dynamic. But it has been since, I would say, March 12th, it has been a real swing of what our priorities were going into that the end of that week to seeing the pandemic take over. I know that for me, it became very real the day that Sophie Trudeau became diagnosed with COVID. And then I could start seeing things immediately shift just in that at 7 o'clock that evening on the 12th. Over this period of time, our constituency office has been so busy. We're dealing with lots and lots of businesses that are in our communities. And I know we'll talk more about the businesses later on. But, many people in our communities needing assistance. So we have been going 7 days a week trying to help assist, trying to get people home from countries outside of Canada and with the border crossing. And it's just been a whirlwind, and every day presents us new challenges. So thank you.
Well, thanks for taking some time to be with us today. Minister Yurek, how have you been in the days leading up to this interview here?
Well, it's been an interesting experience. I'm currently in my basement. Usually I'm on the main floor, but my wife has relegated me to the basement going forward, making too much noise on the phone and on computers. So, my office stayed open as long as possible before the staff headed home. But luckily, we're able to have our phones forwarded to each other's cell phones. So I'm hoping we're getting quick response to those that are calling for needs in the community. This is an unprecedented time, and the government, provincial government, moved forward with an emergency declaration early in the process in order to ensure that we kind of contain this virus. And I think we're doing a really good job as a province as a whole. We've really have the numbers in the downward swing, but unfortunately, it's caused a lot of issues with our constituents needing help. The amount of calls we're receiving and emails is tremendous, and my staff, I believe, are doing a wonderful job at responding. Right now, we're prioritizing the emails we're getting in, and just an example for you. The other day, I was responding to emails, and for every 2 that I responded to, because they're just not quick responses, 3 had come in. So it's kind of a
one step forward,
I guess, a waterfall of the emails coming in. So it's hard to keep up on the responses, but we are prioritizing them. So those that, we've had quite a few people calling, needing shelter or food, et cetera. They're getting immediate priority calls from my staff. The other parts of my day, so usually the morning I spend doing constituency work. In the afternoon, I have to take care of my ministry work with regards to Ministry of Environment, Conservation, Parks, as we are reviewing the processes in place. And in the evenings, we have cabinet calls. So it's a pretty full day, and we try to ensure that we're looking after everyone we can in the riding. And I just want to thank everyone in our riding for doing their part in containing this virus, because together we'll beat it, and we'll have our businesses open that much sooner. So thanks.
Thanks very much, Jeff. And Joe, Mayor of St. Thomas, Joe Preston. Well, it certainly has been a very busy 40-some days. It is, we've been, we have the special piece of having to keep a city running along with deal with COVID-19. I know each of you have things you have to keep going. And I thank both Jeff and Karen for being open to every phone call that I've made, and there sure has been lots, and vice versa. We've been really conversing a lot about what to do. But from a municipal point of view, you've got to, people reach out and expect the water to come on. People flush a toilet and expect it to work. People put garbage out at the road and still expect it to be picked up, crisis or no crisis. And so most of our job here at the city has been keeping the city functioning in a safer way than it used to. Emergency control group meets every morning right after a long phone call with the minister, with the health board, with the daily update. And council meets tonight too. So none of this stuff is stopped. It's done different ways, whether it's done by video or teleconference call or I'm sitting in the mayor's office right now, and it's almost eerie at City Hall when there's almost no one else in the building. It's been one of the safest places to come to work because you almost never run into it. The City Hall is closed, and so a lot of functions still going on, but we've got people working from home, people distancing in different offices, that type of thing. But it's been a cooperative effort to keep things going between the federal government, the provincial government, and the municipal governments. And of course, even with us, the neighboring communities too, on how we can help each other stay functioning. So it's been an interesting time, and I'd love to come out of it.
As we all would, for sure, and meet face to face one of these days. We'll start with Karen. We'll ask some specific questions because a lot of people out there, I can tell you from experience, I know are reaching out to Karen and Joe and Jeff's office. But there's some very specific questions that a lot of constituents are asking that are steady. So I'll start with one here for Karen. The constituent says, I received the CERB or the CERB emergency benefit, and I'm not entitled to the benefit. How do I return that money?
Well, that's a good question. So first of all, the CERB benefit is the Candidate Emergency Response Benefit. And it started on April 6th. It's gone to anybody who has not been able to work since March 14th. That is the starting date, March 15th, sorry. And basically what's happened is there's two streams. There's the employment insurance stream, as well as the Canada Revenue Agency stream. And basically they pay $2,000 if you're on EI. It's $1,000 every 2 weeks, and yet you must report. And if you're on through the Canada Revenue Agency, it's every 4 weeks, and you must call in and kind of re-qualify, making sure. But what's happened is there has been a lot of people, and I understand due to the desperation, many people applied for both. Many people went on the EI call in the Service Canada and went on to Canada Revenue Agency. And then even some people, twice went on to Canada Revenue Agency, and somehow even with the same social insurance number, got two payments. So we immediately recognized that this was an issue, and we brought it up to the different ministers that were working. What they're doing right now is if you have a check, now I know I use checks, but a lot of people still don't use checks. They're allowing you to send money back through checks, or as of May the 11th, you'll be able to go onto your Canada Revenue Agency account. And if you don't want to have one, please sign up and you can return your payments there. But the bottom line is you're able to receive $8,000 in total through the CERB benefit. So regardless of how you're receiving, it's $8,000 as total, and that's a coverage of 16 weeks. So, if you have any questions, give my office a call. We're here to help.
519-637-2255 is, we should probably throw those out there right now for Karen's office. Now, Jeff, what is the provincial government doing? You are actually in government, so it's a little bit different position for you. What's the provincial government doing to help people and jobs during this pandemic?
Well, we came out early with a $17 billion package that helped people, it helped businesses, and it's also reinforced our healthcare system. The one issue that we had, the province is in charge of paying for our healthcare system, so we reinforced it with $7 billion to ensure there was capacity in place, to ensure that there was proper equipment in the ICU units, to ensure that the hospitals were able to decant or remove those patients that are not needed to be in a hospital but are stuck there for one reason or another into other facilities. So what that resulted in was a structure that gave us enough capacity for a potential ramp up of the disease. At that time, when we announced that, we didn't know where this disease was going, but following what happened in Italy and China and in the United States, it wasn't looking very good. But that $7 billion we put forward into the healthcare system really helped where we're at today, and it's ensuring that we have a healthcare system for the people of this province from end to end. The other $10 billion was spent in deferrals, whether it be tax deferrals such as employment health tax for small business and medium-sized business being removed, to ensuring you don't have to pay your taxes on time, put it down the road. We looked at ensuring that the gains payment that low-income seniors received was doubled. We ended the tiered pricing on energy, so everyone's paying the low rate for energy right now, so that their costs have cut down. And the other thing we did is ensure that those kids on OSAP, we deferred their payments and stopped the interest charges on that during this time being as we get through this. So all in all, I think we've had some base level support that dovetailed into the federal support. We wanted to try to fill in the gaps, and it's ongoing every day. We're fine tuning items, and we came out with that the pandemic pay for all those frontline workers to boost them up, ensure that they're still able to go to work and support them in their day-to-day needs. So it's ongoing. We'll see more coming forward.
Perfect.
Actually, this is where I want to. What does frontline workers? What's the definition of that? Because we have a lot of people that aren't sure if they're a frontline worker or not.
Yeah, there's a list online, but it's mainly at this point it's frontline workers who are employed one way or the other through the government. So it's more of the public sector workers going through. I know some of the private sector businesses have already stepped forward and gave their staff a benefit of one side or another. But these are the folks that are interacting with the COVID patients. There's a huge list that was published that the Minister of Health and the Treasury Board put together, and they're reviewing it as we go forward. But we're trying to make sure it's fair across the board and that ensures that those people are able to get to work. I might add, we have also added, and we're working with Mayor Preston on this. We're also providing the free daycare for frontline workers if they need them, to ensure they can still go to work or return to work, those that didn't have it. And the Ministry of Education is working with the City of St. Thomas to try and ensure that we have those open spaces here in Elgin County.
Awesome.
Perfect. Great answer, Jeff, and great question, Karen. Thanks very much for stepping in with that. I was a little tongue-tied. Yeah, it's all right. So, Joe, what's going on with the city? I know we've got the federal level, the provincial level. How is the city? How are you and council helping the residents of the city of St. Thomas?
Well, mostly, as I said in my opening, by ensuring that city functions are working. The buses come. The buses are free transit at the moment. And that the water works and the trash is picked up and the recycling happens. Those are all of the things that our emergency plan is to ensure continues to happen. We've also deferred interest on taxes and also the penalty on the April tax bill to give some people some cash flow. And we thank the province for giving us some tax flow by deferring some of the payments that municipalities have to make to school boards, so that we have that extra cash flow at the moment. Municipalities can't. So we're one of these places where if we spend it, we've got to find where we're cutting it. And so we thank the province for certainly helping us with that. So the deferral on taxes is one of the first things we did. Of course, the minister mentioned the flatlining on the electricity rates, and that's helped a lot of the communities on their tax bill or on their electricity bills or hydro bills too. Our EDC, our Economic Development Corporation and Small Business Enterprise Center, has been working really hard and really fast to get as many companies online that we can. Companies that have been shuttered, they're closed. They can't do any business at all at the moment. A bit of an imbalance about who can be open and who can't be open versus small retailers. And so we're really working on getting some of those small retailers online, getting some business for them as quickly as we possibly can. So at this moment, it's more working with those other levels of government, but we can do some little things with ours too. We know that there'll be a larger role for the city to play as we start to roll out. At this moment, it's just keeping things going.
Thanks, Joe. Now, Joe and Jeff are business owners, as many people know, in the city. So I find it quite interesting, actually, how a lot of businesses have come together and reached out to all levels of government to ask and provide suggestions. For example, being allowed to deliver alcohol with takeout orders. How are you, Jeff? Is part of Yurek Pharmacy. I know I use your pharmacy, and I noticed it's all taped off in there with plastic sheets, and everybody's wearing the PPE equipment, and they're in there and they're doing a great job. Joe, with Wendy's, you're doing free delivery for orders over $15, I understand. Those are great ways. What do you see in the future as the way things might continue on in that type of venue?
Well, if I can go first, I think some people are finding out, you don't always have to leave your house to enjoy the great things in St. Thomas. And so that may stay on. I would bet there'll be a little bit of wanting to get out of the house immediately following this. But I think some people have learned some new habits, that family time is good and fun. And we enter into Mental Health Week where we know we want to make sure we're being good to ourselves while we're asking you to shutter down and stay home. But they're making some habits in town. And they're also, you can go for a walk. And it doesn't have to be a planned gym time exercise. It can be a walk around your neighborhood on your sidewalk. Just stay away from other people, and that will work. Those are some of the things we're working on. Okay.
Well,
yeah, I'll jump in. Our government last week released about 79 or 69 different guidelines for businesses and how to provide a safe environment. And I think what you're going to see going forward is a more emphasis in our businesses on hygiene and safety. And you'll see more plexiglass or more social distancing to prevent a future spread of this virus over the next year and so until there's vaccine or treatment becomes available. But going forward, there's going to be unfortunately, other incidences of viruses in our communities. It's also great for the yearly flu. So I think you'll see that type of change. I think you'll see if businesses are able to schedule appointments, schedule how you come and visit them. That will be going forward. We mentioned the Good Life this week announced that going forward, you're going to have to book a time to go work out or book a time to make a class. You just can't show up and work out. So I think people's lives might become a little more scheduled over the short term. I don't know 5 years down the road what that would look like if we get out of that habit. It's human nature. We'll probably try to revert back to where we were. But I think in the short and medium term, you're going to see a lot of regimented schedules for people's lives and for how businesses operate. But I think as we rev things up again, I think you'll see a resurgence of buy local, support local, because those local businesses and community members were with us through this entire thing.
Awesome. Now, Karen, federally, what is the as far as you know, the federal what's the word I'm looking for? The recovery plan. What is there of stages of reopening things as the pandemic eases up here a little bit? What's the goal of the federal government?
Well, right now what we're seeing is the provinces, and just as Jeff has noted, the provinces are looking at how to reopen and working with the federal government. So overall, the federal government will help put in a framework on what that should look like, because you want to have the same things in one province to the next. Out in Saskatchewan, they've come out and rolled out a plan. It's a 5-phase plan, starting with your healthcare workers first, making sure those are released, and different levels of that. Now, it's really important that we are working together and making sure that, we look at the different regions. We know that some of our provinces haven't been hit as hard as what Ontario and Quebec, especially Quebec, have been hit. But when you're looking out in Edmonton, where Edmonton has very, very few COVID-19 cases, but in Calgary, there's a huge influx. So, right now, as we're looking at these types of things, I'm working on the Conservative COVID-19 recovery plan. I'm on the cabinet for that. We're talking about what does it look like for a border crossing. And right now, you're able to cross the border if it's an essential service. So, if you are dealing products or anything like that goes from south to north of the border, you're able to do that and continue, which is really, really important for our manufacturing sector, and especially our grains and oilseeds and our farming sector as well. Those are types of things that we'll really be focusing on. What does essential travel look like, and how can we start opening it up to non-essential travel? That's going to be some big issues happening as well. But the businesses, if you're looking at just not travel, but the businesses of travel as well, you're looking at your airlines, you're looking at places like the London International Airport, you're looking at your small travel agencies as well. And a lot, especially in the city of St. Thomas, we have Marriott. We have the old star, what's known as Marriott, with almost 500 employees. And we know that they're down to about 10% of regular bookings. So what can we do to make sure that we are saying travel either inside of Canada, because we have great protocols that we're trying to work on and continue. But what does it look like when we're saying a destination Canada? Because we know a lot of people are still urging to travel. We have people that are calling our office saying, I'm supposed to go on June 6th down to the United States with my family. Will I be able to travel? I don't know if that's going to be the case. And the fact is, we have to look at what are those numbers in the United States before we open up that border. So there's lots of decisions to be made, but working with the provinces on this reopening is very, very important. And the federal government has a lot to do when it comes to the leadership that way.
So following into that, then, are we entering into a recession, Karen, or are we in a recession right now, do you think?
Well, we have seen right now, if I'm looking at the businesses, I'm not an economist, so I'm not going to throw that terminology out there. But when we look what's happening to our businesses, the first couple of weeks of COVID-19, it was a lot of small independent businesses that were seeing that normal struggle of cash flow. What I'm noticing now is 7 weeks into it, we're now talking about some more stable businesses that are beginning to have some issues. I know this is an American company, but we saw that a company down in the United States was one of the first retail companies that have filed for bankruptcy. These are things that we have to be very, very cautious on and recognize that we have to have the economy rolling. If we want to have social programs, if we want to have anything like this, our businesses need to be opened, and the safety also has to be managed. So it's going to be a really, really fine line. But I don't want to say whether it's a recession or not. We know that the spending right now, our deficit is just continuing to grow and grow and grow, and the debt here in Canada. So we have to have really smart, targeted programs, not just throwing money out the window. So that is something I'm really focusing on, is things that are making businesses more sustainable so that they can get through these efforts and not just throwing cash at something.
Okay. Thank you very much. Now, Jeff, provincially, we are spending a lot of money right now, as Karen mentioned, and Joe, obviously municipalities, you said it yourself, cannot run a deficit. So you're based on what you use, what you have.
Doesn't mean we're not spending more money than we were.
Exactly.
And that's why we have to look at it even in a more detailed sense, because there's been some expenditures that have to do with COVID-19, whether it's helping our vulnerable, our homeless, and other issues like that. Our long-term care facility certainly is costing a little more to run right now than it would otherwise, which means we have to be at least earmarking how will we deal with that after. Most cases we are saying, let's deal with that after, but we better have in mind what we mean, what we might not get to do, or would we, in most cases right now, the provincial government's been exceptionally helpful in helping us deal with each of those issues. Federal government also on some of the food needs point of view, also in transferring of funds to help us with food banks and other things. The provincial government to help us with the special needs right now from a sheltering point of view and taking care of the most vulnerable in our community. So we have to watch. We know where that one day there'll be a tax bill, or that one day there'll be a budget that will have to recover some of this. So we're making sure we're looking at it smartly as we go, but we're not leaving anybody out because we're saying we can't afford it.
And Mike, I want to interject here exactly what Joe was saying about the food shelters and the food banks. Both Shelters Canada, Women's Shelters of Canada, as well as Food Banks Canada came up with a program where here's a bulk of money, we're giving it through this delivery. So Food Banks Canada, for instance. The problem is not everybody is part of those networks. So one thing that we find, especially working at the local levels, which is really, really important, is identifying where are those gaps. So right now I'm dealing with all of the women's shelters across Canada, and there's a contingency fund of $10 million to any group that will not be falling under the foundation or under the women's shelters. So there's lots of gaps that are being filled in. And part of the information is coming from people like Joe to say to me, or Bob Purcell the other day saying, you know, there's this organization in Dutton, there's a food bank, but they don't qualify. So, you know, that's where the public steps up. And how can we help those organizations, or how can the government help them as well? But a lot of times I'm seeing volunteers and the community stepping up to fill those gaps.
Okay. Well, thanks for stepping in there again, Jeff. Provincially, how do you see, obviously, I think the province, people in general are thinking the province is doing a decent job at helping people. How do we recover from all this spending provincially?
Well, I mean, that's what we're trying to lead up in. I mean, I mentioned the 17 billion package we put forward, but in addition, you know, to speak to Joe's issue in Karen's, I mean, we've put forward $200 million extra into the social assistance program, and Elgin, Middlesex, London received 5 million of those dollars to help. We've made social assistance flexible for those special needs that people are on in order to get what they need during this crisis. We've also opened up our social assistance emergency crisis. So anybody that falls through the cracks and is going through a financial crisis that has no ability to action any funds from the federal or provincial government, there is a fast track to get some social assistance. Ontario.ca/social assistance if you want to apply or take a look, or call Delaney at my office at 519-631-0666. And we've also handed out $8 million to Feed Ontario to help get hampers of food together and put forth. But, you know, how we're going to pay for this at the end of the day, part of it is having a booming economy so we can bring in those taxes. So what we're doing, Premier Ford created the Jobs and Recovery Program Committee. I've been named to that as well under the Ministry of Environment. So there's a handful of ministers who are working with their stakeholders of how to invigorate the economy. And I also look at my tasks. My role on that board is also to ensure that rural Ontario, small business, rural Ontario is also has a voice at that table. So we're gaining information to have that discussion of what economic supports the province can do to get everybody up and running sooner than later. And we hope through that and through the work of the Essential Business Committee, which follows the direction of the Chief Medical Officer of Health, that we have a progression of opening up the economy again. We put out our framework of 3 phases of opening up the economy, and there'll be about a 2-week space between those phases, because it takes about 2 weeks for the virus to come out with its symptoms and spread. So we want to see if there's any outbreaks of disease once we change these phases. Currently, we loosened a few of the rules on some businesses that are outside right now. They're starting today, but we'll be heading into phase 1 really soon. We've had about a week of the right trend of numbers. The Medical Officer of Health is asking for at least 2 to 4 weeks. I'm more on the 2-week side of things. The percent of cases in the testing, if you look at the numbers, has gone from about 3% per test of people having COVID down to 2.9. So that's a really, really good direction we're heading in. So we'll head into phase 1 soon, and that'll start the economy up again. And so we have to be there as a government to have those supports in place.
Perfect. Now, leading on to the economy and food, Karen, talk to us a bit about the issues with food processing and our farmers right now. Those are 2 very important things. If you want to break it down into separate ones, I know people are finishing their hogs and ready to ship them off, but there's nowhere for them to go. So tell us a little bit about how you're helping our farmer folks in rural Ontario.
Well, obviously, you can tell within our house, we talk a lot about finishing hogs. So there you go. To any of our farmers, we talk a lot about farming right now, because we know that this is going to become a critical issue. And I'm sure Jeff has a lot to add on to this as well. And Joe, too, knowing that the impact of his own business. But prior to COVID-19, we were seeing a problem with the capacity of food processing, specifically in the livestock. So whether it was beef or whether it was pork, we were seeing these issues. And now what we're seeing is it's gone into the poultry side as well. So what does that mean? Like, for instance, out west, we have, I think, 4 processors. We have seen some stop Cargill had reduced how many people were working, and Jeff may know more on that as well. But across the country, we were seeing numbers really drop on how much could be processed at a time, whether it was because of COVID-19 coming in and having issues with members of that team having the virus, or whether it was the fact that we're putting into that social distancing, making sure that the facilities are safe. But what we've seen is I have people that have turkeys, for instance. They are supposed to be shipping their turkeys out. They know exactly from 36 weeks, they know the logistics of it, from when a turkey comes in to when a turkey goes out. And I'm hearing from my farmers that they may be shipping things. They may be loading their turkeys, for instance. They'll show up to where it's being processed, and there is the concern that they're going to be told to go home because if the plant gets closed. We're seeing a lot of pigs that they're talking about having to euthanize. But then on the other side, the grains and oilseed side, this is a really tremendous change that we're seeing. We know that the amount of ethanol being used, there's a whole issue when it comes to the oil and gas sector, which is very, very different from this. But with the number of people not driving, even the ethanol requirements have gone down. Not everybody's out there, so not using the amount of gasoline that they've had. You and I have put in a tank of gas in the last month. So looking at that type of influx, there has been a reduction in what's needed from the grains and oilseeds by 50% in the ethanol. There's issues like that that need to be addressed. And how do we keep our farmers supported so that they can continue to provide not only for Canadians and the local people here, but for the world across? Canada is a resource of food all the time. Our farmers don't know if it's a good idea to plant. Because we also had issues with getting workers up here, and we're still trying to get workers on farms right now. People need to plant, people need to harvest, and this is a really, really difficult time. Grocery stores, people are walking in there and expecting there to be meat. And I just read an article yesterday saying, that there's lots of food. Well, yeah, there's lots of food, but if it's not processed, it won't be showing up in your grocery stores. So that's just something that we're really working on and making sure that the Minister of Agriculture knows that and say, we need to work on this capacity. It needs to be built now.
Jeff, provincially, what are the thoughts provincially?
Well, we know that agriculture is going to be a large economic contributor, and we have been hearing the concerns. I've spoken with Minister Hardeman numerous times. The province just recently worked out a deal with the federal government to expand the Agri-Stability Fund access to it. So I think that's help in the short term, but he is looking at other supports that we can put forward, because I've heard locally from farmers, they're having issues with storage, moving the grains from last year's grains, getting them onto the market. There's contract issues. The prices are starting to bottom out. Our ethanol plant in Elmer, which employs quite a few people, that is vested in from our local farmers. That industry is in trouble as well. So we've taken some feedback back from them to see how we can work, ensuring that they have a path forward to remain open. As Minister of Environment, and I hear it when there's unable to process pigs, for instance. They have to dispose of those pigs, unfortunately, in our dumps. So we have to get special permission to allow them to add to the landfill. It's just so frustrating when we have food available that we just can't get it onto the market, and instead it goes to waste. And environmentally speaking, adding organic matter into our landfills is not a way to reduce our greenhouse gases. It's not a way for a sustainable environment. So I'm hopeful as things get rolling again. I know the processing plant in Alberta is starting up again, which is great. There's one in Pennsylvania, which I believe is still shut down. We need to ensure locally we have our ability to get our farmers' product to the marketplace, and allow them the opportunity to grow their food. And I'll work hand in hand with Minister Hardeman to get those supports up at cabinet and passed.
Great. Now, Joe, as a business owner, as many know, Wendy's, you had a shortage of hamburger patties. So this is affecting you directly.
Certainly, it's fun owning a hamburger restaurant that's still operating that can't get hamburger. That's the problem. We've had some shutdown in some of the larger packing plants, and we're one of the more favorable customers. And so we had to decide that we want the 4-ounce patties or the 2-ounce patties. You have not been able to get your junior bacon cheeseburger there this week because we can only get a limited supply. I really, truly was faced over this weekend with getting very close to being completely out of beef in a hamburger restaurant. So, it's about, I want to say thank you, though, to the grocery stores and the supply chain and the job they have been able to do during this. We forget sometimes that these are people out there having to make contact with people they don't know in order to make sure that grocery stores are well stocked. That stuff doesn't just show up on the shelves in the grocery store. It's brought there from a manufacturer on a truck in the back door and then put out. Look, there's some heroes out there that are driving trucks and working the cash registers at grocery stores, and we need to really thank them for all they have done too. It's keeping this country fed is a big thing, and do it in a time of crisis, it's a bigger thing.
Mm-hmm. For sure. Now, I wish I owned stock in Zoom, because I have a feeling that whoever owns Zoom is going to be making a lot of money lately. But in particular, there were almost 338 members of parliament recently who met virtually for the first virtual sitting of the House of Commons. Karen, do you want to comment on that? And how did that go as a whole, overall, since you weren't right on top of each other? How did it go virtually from your living room?
Well, thank you. And for anyone who saw the picture, you can see that I had to use a 15-liter thing of container of popcorn to be able to elevate my screen, because there's certain things that they need. But luckily, I had been on Finance Committee the week before, so I had already been on Zoom and understood some of the issues that might happen. The one thing that has really come clear from this is that we have an internet issue across Canada, because 338 members of Parliament who should have been able to have access were not having access. Dan Alba's a good friend of mine from out west, living in BC, and another gentleman, and Joe used to work with Kyle Seabach. He's out in the Durham area. They were not able to be on Zoom. So you're thinking of these areas that are in big populations that aren't able to get on Zoom. So what that means is you're expecting 338 members of Parliament to be able to participate, but if they're limited to their access to internet, they're not participating. So in total, I think we had 298 people on the call at the time. Probably about 45 of those were administration, because there is a lot of administration, interpretation, those types of things. So I would say, 2/3 of the members were able to access. It worked out okay. Even you forget to mute and unmute and those types of things. You're dealing with the average age. I'm 49, but you've got people that are 75, you have people that are 23. And so you're dealing with technological capabilities that are really different. And so, telling Wayne Easter, you need to unmute, or meanwhile, that would be an issue for our 22-year-old MP that are in the House of Commons. So it was worthwhile, but at the same time, that accountability. And I think I've said this to you, like right now I have the screen, and so I can say what I wish. That accountability is really, really important. And having those debates in person, I think we can see, that you can connect personally, but how personal are you connecting? Lots of people call it heckling, which I don't really support heckling, although yes, I do it sometimes. Sometimes you have to call people out, sometimes you have to say, but that's outright untrue. And what we're finding in this is you're muted. So you don't have the opportunity to feedback. So sometimes I was listening to things the other day going, but that's not how I know it. And you just don't have that ability to respond. And, you have to hope that it's all being covered, but, we're figuring it out. For me, as we're moving forward, and I know Joe as a previous chair of a committee, I'm sitting here going, wow, I can save a lot of money as the chair of Status of Women. I'll be able to save so much money because people aren't going to have to fly in, and then there's not going to be the hotel expenses. We can Zoom and make a quality committee doing this type of thing as well. So let's see how we're moving forward.
Perfect. Jeff, anything provincially, or I know you probably have a lot of Zoom meetings in general, but any word on provincial parliament returning with a Zoom version?
Well, I do have to say I learned something new about Zoom every day. Just a minute ago, I had a Skype call, and apparently it blocks me out of Zoom once the Skype comes in. So, hopefully they don't call back. If you're listening, don't Skype me right now. Our meeting's postponed a bit. So, I think there's a couple things I'll just touch base on. We have the same issues as Karen would have if we had Zoom in the provincial government. Northern Ontario, rural parts of Ontario don't have the bandwidth to actually have Zoom up and operating. It eats too much of their data, which is unfortunate. I think we're seeing it in our area when we've moved education to online. There's certain parts of the riding where the poor kids aren't getting the access, or if they have multiple kids in the family, they're either having to drive to an area to pick up some Wi-Fi or trying to figure out one way or the other. I know our government's working on expanding internet throughout the province, and I should have a good announcement sooner than later with regards to Elgin and Middlesex. But can't divulge much of that at this point. But those parents out there that are having difficulties accessing the internet, contact your school board, because our government has provided some supports. Whether you need the hardware to do the educational spot, or if there's ways to get some access to some data. I know we've made a deal with Apple, and we have iPads with data attached to them to give out. I don't know whereabouts, but you have to go through your school board to see how they can track that stuff for you. Provincially, we're going back at this point, May 12th. We're going to meet twice. It's going to be very few people in the legislature. There'll be social distancing. From my understanding, all the details are still being worked out, but the opposition will let the government know which ministers are going to be asked questions, so those ministers are present for question period, and then there'll be some of the other members to fill out some of those seats so that we have quorum and there's enough people in there. So the provincial government won't be sitting online at this point. I think we have to change some rules to even allow that to happen, but we will be in person probably twice a week starting after May 12th.
And Joe, what about St. Thomas City Council? Still planning to head back to City Hall one of these days?
Oh, sure would love to. We've had 4 or 5 meetings now, all on teleconference. We haven't moved up to video conference yet, but that looks like that may even happen for tonight, if not for tonight, but for next Monday. I certainly over time have done a number of Zoom meetings or other meetings. However, I really truly dislike them. There's something about being able to, something tactile about being able to see someone, right? Or have the dog bark while you're making your comments. But it just is more like you get to know these people, so you know how they say something tells you something maybe more than what they're saying sometimes. So yes, we can still function. We get things done. We can ensure that budgets and bylaws are passed and those types of things. It will be a lot better when 8 or 9 of us can sit in a room and truly have good discussions, good earnest discussions, and not have to mute each other.
I agree.
Really a lot better.
I agree. And wait for that other person to finish before you start speaking. Yeah, I get it. Big topic, I'm sure, for all 3 of you, seniors. So everybody's just kind of nodding right now. We'll start with, we can start with Joe in the city and talk about the seniors here in the city, and then we'll work up through Jeff and Karen and have their thoughts on where the senior situation is. Joe?
Well, our functions as a city have stayed the same. So what we deliver to seniors has stayed almost exactly the same, except for perhaps the closing of the senior center. The things that the city does for them, whether it's transit or just plain roads and garbage and those types of things, have stayed the same. Our long-term care facility and the other care homes for seniors are all functioning. They're functioning different than they might have otherwise. But that's the method of a city during a crisis like this: is can you keep things going that you would normally be doing? And we measure ourselves on the city's still open and the city's still functioning. So whether it's for seniors or school-age kids, we're doing our best to do exactly that.
Okay. Jeff, how about provincially? Helping out our seniors. Talk a bit about.
Well, we're trying to ensure that we're looking after everyone in this province, and for seniors, as I mentioned earlier, those that are receiving the gains check has been doubled at this time to help them with any additional costs they may be having. Our hydro plan, where we rid the system of the tiered pricing, and it's now the lowest flat rate pricing. I think that's really helping reduce some costs for seniors in this province. We are looking at ways to keep them connected throughout our communities as we go forward, supporting those agencies that are reaching out to them for assistance. Long-term care, I mean, that's a tough one, but we've really put the efforts forward to ensure that as we ensure that there's a barrier to ensure that COVID is staying out of our long-term care homes. I think we've done a wonderful job. Our long-term folks in Southwestern Ontario, London and St. Thomas and Elgin County have done just a tremendous job at protecting our seniors, and kudos to all those workers out there. And then the seniors in our communities, thank you very much for being patient. I mean, you're the generation, either the edge of the Great War or children of those of the Great War that fought and gave us all our liberties and freedoms. And here you're living in a time where government of all levels have kind of taken that freedom away for the protection of this pandemic. And one of my goals is make sure we get that back to you as soon as we can. But thank you for your patience and social distancing and keeping each other safe. It'll pay off in the end. And finally, the biggest issue I'm hearing from seniors is regards to the dispensing fees that they have to pay in order to ensure supply. The government told pharmacies to cut back to 30-day supplies instead of 100-day supplies because the wholesalers in the province were rationing the drugs to ensure there was enough. So a pharmacy may order 3 bottles by 100 of Lipitor for dispensing and only receive 1 bottle of 100. So instead of giving all that to one senior, you're now giving it to 3 different people. So it was ensure that people had supply of their medication, because it is a concern worldwide. We get the majority of our medications from around the world, and those parts of the world are also having issues with COVID. So, but unfortunately, what that transpired is some pharmacies were charging full fees every month, some were charging part fees, but at the end of the day, it was an increased cost to the seniors to access the medication. We do have a solution in place. It's just going through final public consultation, but if it goes forward, which I'm pretty sure it will go forward, seniors will only have to pay 1 dispensing fee over 3 months, but still only get in monthly increments to keep the supply in place. But that's right now on the government website for consultation and review, and I think it's up today. So we'll see where that goes. But that's going to be really beneficial to all seniors out there. That'll save them some more cash.
Okay, thanks, Jeff. Now, specifically, Karen, I know we had some actual real questions from real constituents here, and one of them happens to be a senior. I'll just read it. They are on, and we all know people who are on fixed incomes. They have all their savings in a stock investment portfolio. What's the government going to do to ensure that seniors on fixed incomes are able to have adequate income during the pandemic?
Well, this has been such a difficult time for seniors. Not only do we have the concern with self or social isolation and physical distancing, families trying to go over there and help out their parents. We both have senior parents with my mom, 80, and my father, 84 years old. I'm very cognizant of them getting sick. And so we've all taken into this idea, like, let's protect our seniors, but at the same time, we have to worry about their mental health. So that's one little thing. A note I wanted to say is thanks to all of the support workers who are there supporting our seniors in those homes and providing the care that they need. And to all the families, let's just continue to do our best to keep them safe. And that's something that's really important. But what we're hearing right now is from a lot of seniors, the cost of living. Yeah, there is the cost. There may be a service charge for delivery. There may be some increased costs because of supplies. They may seem nominal, but when you're living on a fixed income, these things add up. And so, a person may have, at the end of the day, they may have an extra $200 for their groceries and everything after they've paid their rent and their utilities and their insurance and all of these costs. We know a lot of seniors who that live off not just old age security and Canada pension plan, but also have their investments. And what happens with those investments, when you're seeing a fluctuation, you're seeing those investments go down. So they're able to draw less money. The government has put through some things when it comes to the RIFs, reducing and different changes to what they've done there. But it's not just a one size fits all when it comes to seniors. I've had some people say, well, we'll increase the guaranteed income supplement, which is similar to the gains of what you have at the province, but it's the additional money that's a supplemental payment that goes on top of the old age security. And it's really focused on the low-income seniors. But we're not just seeing low-income seniors, we're seeing that group that doesn't qualify for the guaranteed income supplement because they have those other pensions. And so I could get into the technical part, but what I'm seeing now is there's the people who have the actual guaranteed money, your old age security, your GIS, and your Canada pension plan. And then those are the people that have their Canada pension plan, their old age security, do not qualify for GIS, but their savings has just shrunk so much. So we've got a gap here right now that we will need to address, because we know that there are a lot of seniors, a lot of single women seniors, and a lot of single seniors that are living off just small means. And so it's really exemplified this issue. And we need to address this, but it just can't be a one size and says, this is what we're doing for seniors. We need to look at the entire idea of what a senior looks like, from some people that are in long-term care homes to other people that are 99 years old and living free as a bird. We have to make sure that we give them a quality of life and give them some hope as well. Okay, thank you very much. Joe, anything to add there?
Yeah, we also, where the rubber hits the road, because in a municipality, we closed our library, of course, right? And so we have employees from our library who've just ramped up a fantastic system called Community Connects. And it's a phone line that people who need a little help, as Karen mentioned, that you maybe can't get over to your senior parents' house to help them like you used to. And so we have community volunteers matched up with community need. So I know there's one lady who just can't take her garbage out to the curb. So one of our volunteers goes every Tuesday morning and takes the garbage out. We've matched up lawn cutting. We've matched up needs of going to the drugstore to pick up product or go to the grocery store. But this is our library staff flipped over immediately, said, let's do this. Let's run this community cares hotline. I'd love to see it stay in place even after this crisis, that we have a community phone number where people can call just to ask for something small or something big, or to say, how do I volunteer? We're just gathering such a great community by doing it this way. So it's another way we're really quite helping seniors.
Well, we are lucky that we live in such a great community, St. Thomas and Elgin, Middlesex, London as a whole, for sure. We are definitely helping each other out through this. We've got about 5 or 6 minutes left, and I want to give everybody a couple of minutes to give a wrap-up thought before we leave this Road to Recovery program. But I do want to ask one thing. As we move into the nicer weather, we're into May now, people want to be outside, people want to golf, people want to go to the park, people want to go to the beach. Talk about that. How is that going to affect people? Do we think that is going to be an available option soon, or do you think that's going to be closed down for a bit? Jeff, do you want to start?
Sure, just throw it all onto me. I love it.
Well, why not? No, I want to have a bonfire too one of these days. So just let me know.
I'll talk to Aunt Sally on that one. Listen, thanks. I just want to say I really thank everyone in our community. It isn't tough. This is something new for all of us that we've gone through. And, I think governments of all levels are trying to do their best to provide health and safety for everybody. And there's always going to be a way to look back and point out what we did wrong or what we should have done, could have done. But everything's being made based on the decisions of the now, based on science and based on our chief medical officer of health for all the decisions we've made. It's not going to be perfect. I wish it was, but it's not. And anybody who thinks they can create a perfect government, don't vote for them because you can't. But you do your best you can. And that has been the effort we have. So just last week, the Premier announced that marinas and golf courses can get ready for the season. That's a good start. So they'll be spending this week getting things ready for the season. So it's hopeful as phase 1 rolls out and we open more things up in the coming weeks that, marinas and golf courses and parks will have the availability to access. But then we're going to have to watch to see if there's a spike. Because if there's a return, if we go too quickly and there's a return, we have to shut everything down again. And that is not going to look pretty. So if we go slow and go right, we'll see the economy open up. So beaches, I can't see many beaches being open in the short term just because of the gathering. You look at California, they open up their beaches and it looked like 1 million people showed up. That's not how it's going to be able to operate. It's going to be small gatherings going forward. But, I tell people eat as healthy as you can, because it's really hard to eat healthy when you're locked up in your house all day and boredom creeps in. Get outside and go for a walk. If you feel like you're going to be going for a walk and there's going to bump into a lot of people, put a mask on. If you want to go and wear a mask anyways, it's makes you feel better to have it, wear a mask. If you're just going out for a walk and you're like in my area of town, like my wife and I go out for a walk every night, and we see the same 4 people walking around, we social distance as we walk by them. So, but get your exercise, get outside. It's great for your mental health. Even if it's only for 15, 20 minutes, get outside. We are going to be opening things up slowly. We're going to give you more access and more abilities to do what you want to do in life. You just got to hold on, stick together, stick to the plan, social distance, stay at home as much as possible, and we'll be better off in the long run, because I think we've come so far in such a small period of time. We're almost there. So please keep the frustrations at bay and work together, and let's get this done.
Perfect. Thanks, Jeff. And Joe, final thoughts?
He said.
Got it.
What he said.
Yeah.
Look, we're not done this yet. We may be at the beginning of the end, but we're not done this yet. We've had too many people who've really suffered with closed businesses to want to hurry out of this and have to go through it again. Let's keep in mind, you're not more special than anyone else. Let's make sure that we all continue to follow the rules until the rule is relaxed. It doesn't mean, oh boy, they're opening golf courses. No, they're not. They're preparing to open golf courses. That doesn't mean, well, I don't golf, so I guess I'll go do A or B instead. Please follow the rules as they go. Thanks.
Thanks, Joe. Well, I'm a terrible golfer, so I won't be one of the first ones out there, although I should be. But and final thoughts from our MP, Karen Vecchio.
Well, first of all, thanks very much to Tim O'Neill and you for putting this together. This is great to have the 3 of us chatting. This is really about us working together, working with Jeff, working with Joe, and first of all, my staff. I just want to start there and pay accolades to an amazing staff. Every day, I do not know what's going to be thrown at you, and you need to be able to rely on people. And I have gotten through this last 7 weeks because of the incredible people that I work with here in St. Thomas in Ottawa. So special thanks to Kathy and Jill, Jenna, Charlie, Tim, who's brand new, Tim and Scott. Right now, we're trying to do our best to serve the people. But as both Jeff and Joe had indicated, this is a really critical time. This is a time where we talk a lot about there being a second wave, and people say there's going to be a second wave. Well, if there's any way that we can be proactive and not allow that second wave, or proactive in making sure those people aren't going to get infected by the virus, we need to make sure that we're putting in the right ideas and slowly reopening things. But we need to be safe. And so right now, as we're going through this time, continue helping your neighbors, continue helping the seniors in your communities and the young moms that may need some support as well. This is a vulnerable time for many. And we've been locked in. And you know, when you talk about that boredom meeting, holy shnikes, I was not bored for the first 5 weeks, but last week I started baking again, and somehow I had gained 20 pounds in a week. But, you know, thanks for doing this. It's really remain together as a community. And that's exactly what I think we've seen. We've seen some great volunteers just step up. And I'm so proud to be part of Elgin Middlesex London. So thank you very much.
Awesome. I totally agree with everybody's thoughts. Folks, Joe, Jeff, Karen, thank you very much for taking time out of your, I know, busy schedule. And maybe we'll do this again in the next week or two, but this is great information to get out to the people of Elgin Middlesex London. So once again, I thank you. This has been The Road to Recovery. I am Mike Vecchio. Thanks everybody for watching. We'll see you again soon.
Bye.
Bye.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
I wouldn't sit there.
Never sit on the couch.
I was worried for this girl. I mean, they were just like laughing about it. What can we do?
Do about what?
I've got unfinished business.
Gina.
I'm gonna find the man who murdered my wife and kill him.
Revenge is what makes a man like you exceptional. Well, that's not good.
said you wanted to meet in person about your story?
We're not taking the story unless we can see the video.
Can you imagine the uproar?
It's a good story.